Awesome. Hey everyone, and welcome to the virtual monthly meetup. I'm Sarah Bolton. I will be the host for you today. If this is your first time, we meet every month, the fourth Monday of the month from 6:30 to 7:30 Central Standard Time. This month, we're excited to have Dr. Liz Plowman joining us from the Pain Boss. A few other things to share. Our March virtual monthly meetup, which is on March 27th. The speaker for that is Brenda Camanares with the Every Life Foundation, who will share about her role at the foundation as well as her MG journey. Also, please feel free to use the chat feature to ask questions today. And following today's session, you should get a survey, and we super appreciate your feedback. And lastly, before we move into the presentation, I want to do a quick intro to the MGA's new community program coordinator, McKenna Fulton. McKenna has joined the MGA and is working in the Kansas City area clinics and support groups. So hi, McKenna. You want to share anything about yourself, introduce yourself?
Nope, I'm just taking over for Allison. I sit in the chat so everyone can see it this time because she's on vacation, and this is actually my first monthly meeting as well. So nice to see everyone and ready for this.
Awesome. All right, well, now to welcome Dr. Liz Plowman with the Pain Boss out of Houston, Texas, joining us to share her experiences and knowledge with movement and Myasthenia Gravis. So Liz, thanks for joining us and being here.
Thank you so much. It's absolutely an honor. It's also nice to see, I'm looking at the attendee list, and I do see some familiar names. So really excited, and I'm excited to bring you this topic. So I'm gonna share my screen. And also share sound. Okay. And let me do that. So I'm sorry. While I do this, because my PowerPoint goes on to 2 slides. So can you tell me if you're seeing the main slide or if you're seeing the note slide?
I'm not seeing anything yet, but it might just be on my end. It says that you've started screen sharing, but I see a blank screen. Does anyone else see this?
I see that. Oh, got it now. See, cracking the code.
There we go.
The note one, or is it the full screen slide?
It looks like a full PowerPoint. It says cracking the code on exercise with MG.
Okay, so you just see that slide, and do you see a whole pile of slides at the bottom, or no?
No.
Okay, perfect. Good. I picked the right screen. I did it right this time. All right, so fabulous. So I'm gonna bring this presentation. So this is cracking the code on exercise or movement or activity with MG. I am, you very kindly introduced, I'm Liz Plowman, for those of you who don't know me. So I am a physical therapist, so movement, activity, exercise, this is really our wheelhouse. This is what we do, but I do also have Myasthenia Gravis, so I live what you live every single day of my life. And so I have really made this into my career. So this is why I am bringing you this presentation today. This is probably my most popular topic that I get asked to talk about. So you may have seen, if you have seen me talk before, you may have seen some version of this, but I change things up every time I do it. So hopefully you'll pick up a new gem if you've seen some version of this before. So just a little bit about me. So I am, as I said, I am a physical therapist, part of the American Physical Therapy Association. I actually just came from national conference this past weekend, and was really honored to be a podium speaker on inclusivity for disability. in the profession of physical therapy. And then I've mentored for graduate students, for doctoral PT students in doing myasthenia gravis research. And they also presented a poster at national conference on developing a physical therapy clinical practice guideline for myasthenia gravis. So I was very, very excited about that. I just wanted to take a moment to brag on them. I'm also a member of the Academy of Neurologic Physical Therapy. So my career took a sharp turn with myasthenia gravis, with that diagnosis. And I went from being a very orthopedic focused. If you had asked me when I first started my career if I ever wanted to work with neurologic patients, I would have very diplomatically told you no. But the universe has a really good sense of humor. So now actually my love and my passion is on the neurology side. I still do orthopedics, but neurology is where it's at now. I was a physical therapist in the United States Navy. I was active duty in the Navy before MG, and MG is actually what resulted in my retirement from the Navy. So it was a fun career. I think I have some photographs later on if you want to see that. I do have my own private practice. It is Pain Boss Physical Therapy. So I see a combination of orthopedic and neurologic patients, but really patients who need that little extra TLC, that one-on-one care. That is what I do, and I love it. I also have an affiliation with Texas Women's University. I was on faculty with them for 3 years, trying to make the next generation of PTs much more knowledgeable about MG, and I hope that I succeeded with at least 3 years worth of them. And then last but not least, this is kind of my own little moniker, because like I said, I'm a PT and I have myasthenia gravis, so I kind of branded myself myasthenic PT, and I try to put out information that's helpful on that. So that's a little bit about me. Disclosure acknowledgement. So I have nothing to disclose. I don't have any products or anything like that I'm pushing or selling. I do want to acknowledge that some of the research behind this presentation, I do want to give thanks to my grad students. Grad students never get any thanks or love, so I want to make sure that they get thanks and love because they have contributed to the research in this presentation. So coming up in the next half hour, we're going to talk about what is exercise or physical activity. It goes by many names. What is it? What is this movement? We're going to talk about health benefits of regular physical activity. We're also going to talk about the MG concerns that come with that. That I'm sure several of you are scratching your head saying, wait a second, hold on. I can't exercise like I used to because of MG. So we're going to address that, and then we're going to talk about recommendations for safe exercise or activity with MG. So I'm going to pause here for a second because there's something that definitely sparked my interest in creating this presentation. And I was on an online board, and I love online boards. I do. I've met wonderful people through the online boards, and it's a really good resource to be able to share information and share common experiences. But there's some interesting information out there too. And there was, I can't even remember which board it was I was on, which MG board, and there was a post about someone asking, right, what can I do, exercise? What are some things for me to do that's safe? And there was a reply. There were several replies, but one that particularly stood out to me was basically no exercise is safe and will only make you worse. There's no point in doing it, so don't bother. And I usually don't respond, but I couldn't professionally. The PT in me just cringed, and I couldn't not respond. So I asked about, well, there's a lot of health benefits and importance, and even with MG, and I'll get into this in the presentation, right? We've got to maintain heart and lung health. We have to maintain a certain level of muscle tone just to even function. There's the blood pressure, heart. I'd like to not have heart disease, diabetes, or obesity, and just the list goes on and on and on. Her reply to that was, I can take a pill for every single one of those. So no, it's not worth it. And that's where I stopped. I'm like, okay, I'm not gonna continue this argument online, but that just that made me create this presentation, or the early iterations of it, and definitely get the word out that there is a way for us. So spoiler alert, there is, and it's important to be able to do, not just for the health benefits, but for the personal benefits as well. It's important to be able to move and to live our lives and to do things that are important to us. And so, not to mention that, you know, if you just took a pill for everything, your kidney and your liver wouldn't last very long. So, and we need those, especially with the amounts of medication that we take. So anyway, I did not engage any further internet battles, but that was one of the inspirations here for this talk. So, can I exercise with myasthenia gravis? The answer is yes, but with an asterisk mark, which we will get to. So first of all, what is exercise, right? When you think of exercise, just take a moment, and what do you think of, right? Just kind of mentally go in your mind. I can't see the chat, so if you're putting wonderful things in the chat, I can't see them, but that's okay. Just think, right? What do you think of as exercise? Most people think of this. I don't know many myasthenics that can do that. There's a few, not many, not the majority of us. Some people think of this, right? But exercise or activity, really, it's anything that gets you moving, right? This is also activity, movement, exercise. So it's that. And that, right? Just, you know, it doesn't have to be pumping iron. It doesn't have to be running a marathon. It's really just anything that gets you moving, right? I hail from Houston, Texas, so I had to throw in some good country and Western line dancing in there, right? Walking the dog, and last but not least, hopefully that one hits home with a lot of people. Right, I have two little ones. I have a 2-year-old. Sorry, no, I'm sorry, he's 3. I have a 3-year-old and a 5-year-old. I promise you, they are physical activity. Right, so it's not just, you know, I'm going to go to the gym and pump iron, and that for some people that's important, and most, like I said, most myasthenics, that's probably not our best exercise to go through. But right, being able to move and do things that are meaningful and give you joy and satisfaction, those can all be considered physical activity and exercise. Right, so let's talk about the health benefits, and I won't harp too much on this slide because I think we have all watched every PSA and we know what the health benefits of exercise are, right? Good for your lungs, good for your heart. 30 minutes a day, 150 minutes a week, we've heard all of it. But I want to talk specifically about the health benefits that are important for us as myasthenics. So number one, regular movement keeps muscles working and it prevents deconditioning, which, and it's not on the slide, but it also prevents atrophy, which is basically not just, that's where muscle actually wastes away, where you lose muscle mass. And so you lose muscle mass, and that muscle cannot fire nearly as effectively because you don't have as much muscle fiber to fire. So this is really, really important because we want to avoid that. Cardiopulmonary health. So the number one cause of death in the United States is heart disease. So anything that we can do to improve our cardiopulmonary health is a good thing. Also, from a myasthenic standpoint, we need to avoid pneumonia. It's a big deal with us. And so doing things to maintain good lung health and good muscle tone around the trunk and the thorax, and good diaphragm function is going to keep us from things like pneumonia and the sequelae that come from that. Mobility and function. So if you're going to, even just doing basic things around your house, you need to be able to move. You need to be able to take care of yourself. You need to be able to go to the bathroom. You need to be able to take a shower, to eat, to dress, to do those basic activities of daily living, and hopefully a little bit more beyond that, right? You need muscle tone and stamina to be able to do it. Balance and stability. So which is coupled with that next point there, which is fall risk, right? If you don't have good balance and stability, your fall risk goes up. And that increases risk of injury, which if you already have impaired mobility, if your legs just, it feels like you're trudging through quicksand, if it's one of those days, we're already at a bit of an increase for fall risk. And so helping with balance and stability, that's definitely a benefit. Increasing metabolism. So with, if we take a lot of medications, and the one I'm going to really harp on is prednisone. And it's, you get the prednisone balloon. And it's happened to me too. But anything to help increase metabolism, to help keep weight down, because if we also help keep weight down, that it decreases the load required on our muscles and joints to move. And the bone and joint health, right? So the more you move, the more bones and joints like it, and the bones and cartilage, in order to maintain good health, actually need weight bearing on them. So you need to be upright and moving, and then also improves mood. So if you do physical activity, you get a nice release of serotonin and dopamine, which are your feel-good chemicals, and it does improve mood. So those are some things that, and I could keep harping on this, but I won't. Those are specific health benefits of physical activity to myasthenics, right? So this is why it matters for us. Now, on the flip side of that, we do have concerns. Exercise concerns with MG. If we try to pump iron, like the guy in the very first picture on the collage of exercise, we might end up in the hospital. And so I'm saying this so I'm giving this presentation with that full understanding there. So here's our concerns, right? MG symptoms tend to be exacerbated by contraction of affected voluntary muscle fibers. So your voluntary muscle fibers are basically any muscle fibers that you can think about and move consciously, right? Those are voluntary muscle fibers, or they're also called striated. Not all of them are affected, and it's different on everybody. What tends to be affected more are the proximal muscles, so the shoulders and the hips, the face, the throat, the eyes, the tongue, the neck, the front of the neck, I think I said that one already, the diaphragm, and then sometimes the pelvic floor. Those are what tend to be affected the most. And the more you fire them, the more the symptoms are exacerbated, because that nerve signal to fire basically alerts the body to release anti-acetylcholine antibodies to attack that acetylcholine at the neuromuscular junction, and it impairs the muscle firing. I love the way I've heard Myasthenia Gravis explained once. It was probably the best explanation ever. It's like you have a cell phone tower and a cell phone. Your cell phone tower works just fine. Your cell phone is fully charged and it's on and it's working, but you're trying to communicate on one bar of connection. So that's what's happening there. And the more you work those muscles, the poorer that connection gets. So excessive muscle firing demand can lead to an MG flare-up or even a crisis, which I think we can all agree we need to avoid. Typical, and I'm going to use that typical, use my air quotes there, exercise regimes are generally not compatible with MG. So these are things like, hey, no pain, no gain, feel the burn, keep going, push through, that sort of thing. And then I would also go into high intensity interval training, not all of it, but most of it is definitely anti-MG. These types of things we do not tend to be successful with because they focus on that repetitive muscle contraction, pushing through fatigue when a muscle's already affected, and it can cause that just cascade of an autoimmune response, which is detrimental for us. So those are the concerns. We know the benefits, we know the concerns. Now, there's research. There didn't used to be. research. So if you had asked me this about 10 years ago, if you notice, these are all relatively recent. So we've got 2017, 2018, 2014, 2020. So these are relatively recent. But these studies looked at physical exercise of myasthenia gravis. When it's, I won't go into the whole study, but this particular one, or actually these were the conclusion of two different studies here, did find that that controlled and monitored physical exercise is safe, and it does actually improve physical performance measures. So those would be things like looking at someone's balance, looking at someone's walking speed, looking at someone's endurance. Balance strategy, specifically training balance strategy improves balance, which is that's good because that's the point of balance training, but it decreases fall risk, which helps prevent injury, which is a big deal. An independent exercise program under good neuromuscular guidelines improve community participation. So this means that these are things like going out. This is shopping. This is doing activities with family. Generally participating in the community. And then directed exercise, and that's the thing, that it's that directed, controlled exercise with neuromuscular diseases. And these studies that talked about neuromuscular disease, they had subsets, and one of their subsets was myasthenia gravis, and in both of those studies, the MG patients were successful here. So it wasn't just lumping everybody together like we've seen in previous studies. So that was pretty neat. It was nice to see us represented in research. So, right, so there's risks and there's benefits, and I know that. So how do I find that middle path, right? I know I need to exercise, but I know it could potentially be dangerous. So is there even a middle path? But yes, there is. There is a middle path here. So number one, first and foremost, and I'm going to sound like an old exercise video from the 80s, please consult your healthcare provider before engaging in any exercise or physical activity that is beyond your current level. So if you're already doing an exercise program and you feel safe and you're not flaring up your MG and everything's good, that obviously yes, please keep your provider in the loop, but that's not what this is for. But if you either don't have any sort of regular physical activity and you want to, this is where you do need to consult with your healthcare provider, probably your attending neurologist. I would also say, and this is a legitimate recommendation, this is not a shameless plug for my own profession, I would recommend considering working with a PT. There are personal trainers out there who have some neurologic background, but I would go so far as to say that in general, I would go a step further and I would work with PT, because the PT is going to know the pathophysiology a lot better and be a lot more familiar with that, particularly for a rarer disease. I would recommend working with a PT who is experienced at working with patients with MG. Just like not all physicians specialize in everything. So you would not go ask your ear, nose, and throat doc about what to do for your MG. Same thing. You would not talk to a pediatric physical therapist about what to do with MG. You want to go to a neurologic physical therapist. So in PT also we specialize. So that's why I popped that in there. A lot of people I know have had experience with generalist PTs who don't know about MG, but that's kind of like your primary care doc might understand MG, but is probably going to punch you to the neurologist. Same deal. So you want to consider your symptoms. Your MG should be reasonably well controlled. I don't mean completely controlled. I don't mean in remission. But you should have a decent enough of a medical regimen to help control your MG. You should not be up and down all the time and volatile. You want to work with your neurologist to achieve whatever this is for you. And that's going to look a little bit different for everyone. You want to consider your physical activity when you are at your best. So consider time of day, consider your medication timing, and also consider when you're having a good day. So I can speak for me personally, my best time of day is about 9, 10 o'clock in the morning. That's me personally. That's not for everybody. A lot of us tend to do better earlier in the morning, but some of us also have a hard time getting going in the morning, or have to, have a morning routine of the things you have to do, and the things you have to do, and then you need to rest. So it's a little bit different for everyone. If you do take methadone, especially the 60 milligram, the quick release type, that takes about 20 to 30 minutes to kick in. So I usually recommend engaging in exercise 20 to 30 minutes after taking a 60 milligram methadone, if that's part of your medication regimen. And then also, if you're having a bad day, that's probably not the day to go and walk the mall. And especially now, right? We're at the very end of February, and I know down here we've already, here in Texas today, I think we hit 84. So temperatures are going to start picking up as we get into the spring and into the summer. So you want to also make sure you avoid overheating. So things to avoid: repeated contraction of the same muscle group. And that's why I put the picture of this guy doing his bicep curl down here. So you see that a lot in the gym, and I'm sure a lot of us have done exercises. We do repetitions of the same thing again and again. That's a no-no in MG. So you do not want to, you want to give muscles what we call relative rest. So you want to basically spread out muscle contractions around the body, which I'll get to in just a moment. You also want to avoid sustained muscle contractions. Yoga is really, really big about this. Yoga loves poses, and I'm not harping on yoga. I love yoga, but yoga has needs to be modified in MG. So these sustained poses, that sustained muscle contraction is that repetitive firing of the same muscle, and that can lead to that fatigable muscle weakness that we see in MG. You want to avoid too much too fast. I see this a lot too. It's all right, I've made the decision, I'm gonna go exercise. All right, I'm gonna go walk 2 miles when I haven't done anything in the past, and then I can't get out of bed for 3 days. So that's too much too fast. So we want to avoid that. You want to avoid pushing through, push through fatigue. Those are exercise cues that I'm sure we've all heard, which worked pre-MG. They don't work now. You want to avoid overheating, and I know I said that on the last slide, but it bears repeating. So things like hot yoga, that's apparently very trendy. Probably not for us. Airflow restriction, that's another thing that's a trend, is to exercise with airflow restriction. Well, that increases the work of the diaphragm, which our diaphragm doesn't need any additional strain and stress on it. So that's another thing to avoid. And then also keeping up with others. So you look around, and even other myasthenics, right? We're all at different levels. So there are some that, activity might be the fact that I can get around the house and do my daily activities. And that's my physical activity. And that's where it is, that's the level for some. And then there's others who are, downhill skiing or cross country skiing and running. And so you want to be careful about, not every myasthenics at the same level. And so you want to keep up with yourself post MG. Don't compare yourself to pre MG. And don't necessarily look around and say, oh, well, that person has MG and they're doing so much more, and I can do that too. Maybe you can, and maybe you will get there, but everyone's at a different level. So exercising safely, you want to start ridiculously easy, right? And if you think it's easy, back it down a step, right? You want to start ridiculously easy. If you haven't been walking at all, we're going to start by walking a lap around your dining room table. We're going to start really low. We want low impact and low resistance activities, okay? We also want low reps, low sets, and frequent rest breaks. No extra weight is required, especially when getting started. Simply the weight of lifting a limb against gravity is more than enough. Swimming and aquatic exercise, I'm a big fan of, but I will put a couple caveats in here. You want to stay in shallow water. Even if you're a good swimmer, or we're traditionally a good swimmer, I think we all know how quickly fatigable weakness sets in. And so you don't want to be in deep water and all of a sudden now your legs aren't working, because that, I think we could all agree, would be bad. You want to use a flotation aid Even in the shallow water, it will just help. And then also you want to be careful when you get out of the water, because the water is deceptive. It makes things feel a whole lot easier than they are. And so you can actually fatigue muscles out and not really realize that they're fatigued until you go to get out of the pool. So you want to keep that level really, really low. You want to cycle through movements and body regions to prevent excessive fatigue. So I love circuits. So where I talked about, right, you don't just do a bicep curl again and again and again. So one that I particularly like, and I'll just demo it real quick. I think I can do it. Hopefully my background stays blurred because my office is a mess. So one thing I like is I'll do a bicep curl, roll out to the side, push up over my head, pull back down, come in and down. If you get ready, I mean, if that's enough, you can add like water bottles or weights. But see how I didn't overstress any one muscle. I got a lot of muscles worked while giving rest to each of the other ones as I wasn't working it as I went through that circuit. So circuits are very, very MG friendly. You want to make sure you stop before you're tired. If you're getting tired and fatigued, you have gone too far. You want to stop before you're tired. This is the RPE, or the rate of perceived exertion scale. It's used across for a multitude of diagnoses and conditions, but I really, really, really like it in MG, particularly because it talks about breathiness, which we have lots of fatigue signs, but that's probably the one that we need to be most cautious of, because that can be the most dangerous. So if we start experiencing dyspnea, can't breathe, that's what's going to land us in a crisis, or that's the start of a crisis. That's what's going to be potentially detrimental or life-threatening, whereas other signs, for example, blurred vision, slurred speech, etc., will be inconvenient, but that won't be what is detrimental to health. This rate of perceived exertion scale, if you are working at a 4 or a 5, let me back it down. 1 is anything other than complete rest. 1 is, I'm sitting on the couch, I'm fully supported, I'm watching Netflix, but I'm not looking up too much because I'm not straining my eyes. That's a 1. Light activity, this is doing some basic things around the house. You can maintain this for hours. You can, it's absolutely easy to breathe. You can carry on a conversation while you're doing the activity. Moderate, you feel like you can go for a while. You can talk while you're doing it. You can hold short conversations. For us with MG, this is where the green is where we want to be. In other conditions for exercise, I probably want to be down here in the 6 or 7, but not in MG. MG, I want to be in the green. Okay. If you start getting breathy, it's uncomfortable, you start getting short of breath, you can only speak a sentence, you've gone too far, that's where you need to stop and rest. Okay. So go for green. I also like to use a stoplight mentality. So green is keep going, but keep checking in, making sure you're still green, right? Yellow is where you start feeling your fatigue signs. You might get a little short of breath. You might, we all have our different fatigue signs. For me, I'll start feeling it in my face. I'll start feeling my face almost feels like it's melting. The speech will slur a little bit. We sometimes feel the actual muscle fatigue, that sort of thing. Double vision, if that worsens, those are the signs you need to slow down, or get ready to stop, or find yourself a good stopping point, and scale it back and rest. Red, we should hopefully not ever get there, but red is absolutely stop, right? So people ask me all the time, what's the difference between yellow and red? Yellow, you still have the choice to stop. You can keep going or you can stop, you have the choice. At red, your body makes you stop. You don't have a choice anymore. So hopefully we don't get to red. So my next slide in here, I include, just because I think it's important to remember the why. So I'm going to play this. This is a commercial. It's about 2 minutes long. Hopefully, am I still good on time?
Yeah, you're good on time.
Okay. Okay, awesome. I want to play this for you. It's 2 minutes and 40 seconds. It's a wordless commercial. but it's really, really important on finding your why, because, you know, it's, you know, why we need to be, why it's important for us to move, why it's important for us to do things. So I'm going to play this for you. Kind of gets me every time. So I absolutely love that, because that's the, you know, for him, right, for that man, being able to lift his kid up, lift his grandkid up, to put the star on the tree. It sounds like something so simple, but for him, it was his goal, it was his why, it was what he worked so hard for. Right. So what's yours? Right? What is it that you want to be able to do? And that's the power of what physical activity could do, and why it's so important for us to know that we can do it too. We just have to do it a little bit differently. But and our outcomes might look a little bit different too, but we can do those activities that are meaningful to us. So I just wanted to, like I said, that video gets me every time. This slide right here. So this is, I'm going to give kudos to grad students, because they never get kudos. So I had some research students and health promotion students who were working with MG when I was at Texas Women's University, put together a follow-along series for exercise videos for people with myasthenia gravis. I've shared these out there a lot before, so hopefully you've seen them before if I've done my job right. If you haven't, well, there you go. So there's the link here, and I will share a PDF version of these slides, which will have the clickable link. But also, if you go into YouTube and you search for Safe Exercise with MG, this series should come up. And these, it's three workout videos, and they're not that long. They have built-in rest breaks. They're MG friendly. I made the students try every single one of their videos out on me. And I made some modifications, because there were some things that didn't quite work. But they do a really, really great job. And then the last one was by popular demand because yoga is very popular. And so I mentioned yoga needed some modifications. So, so there's an MG friendly yoga video in there too. So these are great resource if you're looking for a place to get started. There's differing levels of difficulty. There's a seated version, a standing version, and then the Watch Me First video is fabulous. It goes over a lot of things I've gone over this presentation. But again, I have to give kudos to grad students because they did an amazing job with this. And then there's my why. So those are my little ones. This was my daughter. She's 5 now, 5.5. She let me know that she was half today. But yeah, so this was actually when I was still active duty, and she could do better push-ups than I could. And then these are my little ones. They were a couple years ago, but I love they're doing their yoga. They're doing palm tree pose. So, and then there's my references. And then, so here's my contact information. Please feel free to reach out to me. Email's the best way. And again, I will share these slides. So if you can, if you didn't grab my email address or whatnot, I will share these slides, and this will all be clickable for you. But please feel free to get a hold of me. And then,
Thank
oh yeah,
you
that was
so much.
Navy time. Oh yeah, that was Navy time, and then that was a mud run. And I don't think my husband knows that I put his photograph up there, but oh well, I did. Beg forgiveness, not ask permission.
Thanks so much, Liz. This was super helpful and supportive. There's a couple questions in the chat. Let's see. Mike asked, what factors determine being designated as a fall risk?
So Mike, thank you so much for that question. So there are a couple of tests out there that will actually rank, but really, if you're having trouble staying steady on your feet, if you find yourself furniture surfing, if you do a lot of stumbling and catch yourself on the wall, those are some of the things that I subjectively look for in terms of being a fall risk. So those are, so if you were telling me that, I would tell you that you're a fall risk. And then I would actually do a test to actually quantify that. But yeah, if you're stepping and stumbling or having near misses, or you're furniture surfing, then that's your body telling you that you're a fall risk.
Thank you. Actually, my question, you talked about airflow restriction, and I'm wondering, is breath work, is that one of those ones that's considered airflow restriction, or is there something else?
No, that's not considered airflow restriction. So airflow restriction is actually an apparatus that people will put on, and it looks like a gas mask. But what it does is it actually restricts the flow of air that you can breathe in. And the idea behind it, and again, it's a passing fad, and even MG aside, I don't recommend them anyway. The idea is to basically make your body do more with less, and basically to kind of restrict the oxygen. Blood flow restriction training is also another thing, but yeah, that's another thing altogether. But no, doing breath work, doing mindful breath work, there's actually good research on it that it's actually helpful in MG.
Okay, great. Thank you. Stephen asked, I cannot take prednisone because of BP issues. I imagine blood pressure issues. Is Mestinon a suitable substitute?
So I will say, first, let me give my disclaimer that I'm a physical therapist, and it's not within my scope of practice to prescribe or advise on medication. Now, with having said that, those are two different classes of medication. So prednisone is a steroid. It's a steroid, but it's also an immunosuppressant. So prednisone helps work to basically calm down the body's immune response. Mestinon simply prevents the uptake of acetylcholine, so it just keeps more acetylcholine in the neuromuscular junction, hoping that more of it gets through. So those two medicines, they work completely differently to each other, but that would be a fabulous question for your primary care doc or your neurologist.
Thanks. Vernon asked, would taking more than your regular dose of Mestinon lessen more so the side effects of MG during a higher level of exercise or activity?
So, so again, I'm going to go back to my disclaimer on the medication bit. So if you have a prescribed dose, if you have a prescribed frequency and dose, I do not recommend changing that or upping that without talking to your prescriber first. But with Mestinon, you also have to be really careful if you take more. Mestinon's got a nice little balance to it. Just enough does the trick, but too much actually has a reverse effect, and can actually make you feel weaker and then you get tremors and jittery. So I wouldn't necessarily recommend messing with the dose of your Mestinon. What I would do is recommend timing your physical activity and exercise to correlate with when you take that Mestinon, so that you're getting, you have Mestinon at its full peak.
Thanks. Janie said, pre-MG, I lifted weights and did CrossFit. As I build up again, is it okay to slowly and carefully do heavier weight as long as I feel good?
As long as you feel good, as long as you are, so there's no limitation on what we can do. I'm not a fan of telling anyone you can't do something because of X. It's more of a, you have to listen to your own body. You have to know what you're capable of. Every myasthenic is different. There are some myasthenics that can't even look at a barbell or can't even look at a dumbbell without getting symptoms. Hopefully that's an exaggeration. And then there's some that can go to the gym, that can lift weights, that can do CrossFit. And that's gonna differ for everyone else. So if you are at a level of physical activity that you're comfortable at, that you're not symptomatic, that you're not wiped out for 2-3 days, and that's a good level for you, and you're then yes, that is perfectly fine. I would say also just make sure you're giving yourself the appropriate rest break, so you're giving yourself recovery between, and that you're not increasing either your reps or your weight or anything like that too quickly.
Got it. Does anyone else have any other questions that they would like to ask Liz? Feel free to drop them in the chat box. Anything else you care to share, Liz, while we're waiting?
No, I think I said everything I wanted to.
Yeah, thank you.
And I even got
to...
my husband's muddy picture up on that screen too.
I really just want to thank you and acknowledge you for being here today. We all super appreciate super great information, and thanks for sharing your time and your evening with us tonight.
Oh, it's absolutely my pleasure. I'm honored and thrilled to be here.
Yeah, thank you. McKenna, do you have anything else for us before we close?
I have nothing else to say, but thank you.
Okay. Meetup is March 27th. So we'll see you all then. Take care, everyone. Good night.